So all right, we have another action beat coming up, and this one is from back in California, the California HealthCare Foundation, one of the pioneering foundations out there. And Maribeth Shannon from the foundation is going to present the results of their data design challenge, which is really one of the most important parts of the data process is designing it. You have to turn data into information, into meaning, into action, and that is a design problem, not a data problem, oftentimes. So Maribeth also has some amazing buttons and amazing water bottles. She was saying you can fill them with Kool-Aid because she has drunk the data Kool-Aid. The California HealthCare Foundation has drunk the data Kool-Aid. It says free the data. So here to make an announcement is Maribeth.
So good morning, fellow Datapaloozers. I am you can use that. Datapaloozers. I am Maribeth Shannon with the California HealthCare Foundation. And as Thomas mentioned, we are very dedicated to this idea of freed healthcare and using information in order to make healthcare better quality, less expensive, and more accessible to people. Let me advance this. So the California HealthCare Foundation, we did drink the Kool-Aid. We sort of embraced this whole hog and have decided that there were a couple of ways that we thought we could really advance this on the West Coast. And so we have decided on 3 separate approaches. One was really to raise awareness about the issue and the fact that information could really lead to positive change. We wanted to develop tools, use existing data in a better way, and our data design challenge really feeds both of those 2 objectives. And then the third is to actually work with our local state government to really try and repeat what's been done here at the federal level by making healthcare data more accessible. So we launched a data design challenge in March. We had a very small purse, about $10,000 for the total prize winners, but we really got a really interesting group of people, and many of the submitters were not kind of professional data design people, but people who actually worked within the healthcare system. And our winner actually was one of those. It was a team from Providence Health System, which is a West Coast hospital system. So I'd like to actually show you the winning entry, which should be not that, oh, there it is, okay. Sorry, I'm having a little trouble advancing the slide there. So you'll see what this is a sort of an animated poster that walks through a number of questions about healthcare costs, kind of talking about what healthcare costs were in 1985, how it's changed dramatically in 2009, and what the milk equivalent would be. It's kind of an interesting presentation and use of technology to be able to kind of engage you in the story. Walks over, talks about how healthcare compares to other costs. Nice little animated graphic that takes some time. It gives you an idea how healthcare costs have compared to other services, other goods and services. And essentially wrapping it up by saying, and that's why your milk costs so much. But then goes back to try and break it down and show how healthcare costs have changed over time by various components of what's driving healthcare costs. So a 1,200% increase in home healthcare services costs over that time. A 557% increase in physician and clinical services over that time. Prescription drug cost increases of 1,000%. Hospital increases of 461%. And administrative cost increases as well. And then moves over to how all that's being paid for and who's paying for it, and kind of breaks down government and private business, other sources of revenue, household out-of-pocket expenses, and then essentially what it actually means in terms of how these costs are distributed. And the average person, if they had $100, it'd be broken out in this way, with about $7 going toward healthcare expenses. And that's, of course, just the out-of-pocket expenses. That's after everyone else has paid the premiums for the basic coverage that they're receiving. And if healthcare continues on that trend, essentially what will it all look like. There's a little graphic at the top that shows that. So I really want to thank all of the people who made entries, who contributed to this data design challenge. We found it really interesting. We're going to actually post the winners next week, including a slideshow of all of the entries. Though we had intended to do a first, second, and third place and some honorable mentions, we ended up doing 5 honorable mentions because we really did like the entries so much. So I encourage you to come to the California Healthcare Foundation site, chcf.org, and check out these entries next week. Thanks very much.